With Singapore looking to boost COVID-19 testing, how will this all take place? For a closer look, we're joined by Dr. Leong Hoe Nam from the Rophi Clinic at Mount Elizabeth Novena Specialist Centre. Dr. Leong, thanks for joining us this evening. Now, we understand that there are many different COVID-19 tests that are currently used at the moment. Can you help us better understand the differences between the various test kits?
Basically, there are two different test kits that are available. One is the PCR test, which is a swab into the nose. It's a rather uncomfortable procedure, but it's very good because you're looking for the genetic materials of the virus, the RNA. When you find it, you definitively know that the virus is there. It may or may not be dead, but it is a close marker to say that there was a recent infection or there's an ongoing infection. This is the preferred diagnostic tool that's currently used worldwide. In addition, there's a new test that's available in the last 1 month. It is through a blood test where you actually sample the blood through a vein and you're looking for the antibodies to the virus. Now, this test is a little bit different because you're looking for the immune response to the virus. Understandably, that will come on about 14 to 21 days later, making that as a diagnostic tool for identifying patients with COVID-19 to be not excellent because you are going to be late by 14 to 21 days. But it is a good tool to see if the person has had past infections. Now, there is some debate over whether a positive test will confer neutralization antibodies that is confer immunity to subsequent infections for the blood-taking test or the serology test. So scientists are still working that out. And Professor Wang from UCAN US actually developed a new test kit, which was announced recently, saying that he can shorten the whole difficult process for the blood-taking form to make it a 1-2 hour process for determining neutralization antibodies.
So, Dr. Leong, as Singapore looks towards mass testing, what are the considerations to bear in mind when choosing a particular type of test to, in this sense, to get the best result here?
I think it will mainly still be in the form of a PCR testing. The PCR testing will tell you that the virus is there, you find the genetic materials, and chances are the person may still be infective. This will be the mainstay, and hence you hear numbers of 40,000 tests to be done per day. Now, the tests are very important. They make the invisible enemy visible. Now, remember, COVID-19, we can't distinguish them from the symptoms that are asymptomatic and pre-symptomatic. How then do you tell the person carries the virus or not? You have to do testing. South Korea has done it with their massive testing strategy, and so have many other countries, and Singapore is going that way too. Because by doing the test, we turn the invisible enemy into a visible enemy. We know who is infected, who isn't, and then from then we can serve quarantine, serve treatment orders, etc. It makes it much easier. But to rely purely on PCR seems a little bit ridiculous because we have new testing abilities such as the serological test assay. This will tell us if the person has previous immunity to it. And it also tells me if the infection happened 14 to 21 days ago. And we know that this virus can shed in the body for a long time, 3 weeks, 4 weeks, or even 5 weeks. So if the test or the PCR comes out positive, I know he had a recent infection. But if I do the serological test, I know he has protective antibodies. And in fact, he probably had it for at least 14 to 21 days. Then I know his risk of infection to other people will be much lower. This stratifies the group of individuals I'm testing into high risk of spreading, low risk of spreading, or those people who have immunity. With this, you can kind of stratify the population and even the dormitory foreign workers into the at-risk and the not at-risk group.
Well, how can tests then go hand in hand with other measures then that are to sort of stem the spread of the virus and allow life to slowly go back to normal?
Yeah, the thing which all of us want to get back to normal. We have to keep testing and testing. The more we test, the more we find out if they're actually invisible or the very, very mild cases that are out in the community. Now, if we consistently see very few numbers of less than 5 or 0 consistently, this tells us that we're extremely close to it. Number 2, together with serological assays, we can start determining what's the herd immunity or how many people in the group have been infected and not been infected. Now, the more we see less than 5 and 0 cases per day, the more we are sure that there are no community cases. And Singapore is blessed by the fact that it's surrounded by sea and there are only a few ports in which people could come in. Now, if Singapore were to attain 0 cases for 5 days, 10 days, or even 14 days, then the only way a new virus can come onto the shores of Singapore is through an import patient. Now, these import patients will be travelers, and when they come in with a 14-day stay-home notice, quarantine within a designated facility, together with testing at entrance of the quarantine and exit the quarantine, together with a test assay, we can accurately determine if the person is going to be at risk to the population. So as the numbers come down, we begin to realize who is safe and who isn't safe and where the infection risks are, and we can start opening up. And once the numbers call down to less than 5 and 0 consistently, we can open up practically the whole Singapore. Then we only need to look at the foreign travelers coming in.
All right, so what's your assessment on how Singapore is doing so far then?
I think Singapore has done quite well in some aspects, and we could have done certainly much better in terms of dormitory workers. In terms of dormitory and the foreign workers. The foreign workers is a big hot potato to handle, and frankly, even if we could predict it, how we could actually segregate it and work out the foreign workers is really a big challenge. But I think the ministry is actually tackling the bull by its horn and then looking out into segregation areas and putting healthcare facilities down there. In terms of community, I'm very, very happy with the community unlinked cases falling down to less than 5 for the last 1 to 2 days. And I'm hoping that these numbers continue to fall because this will be a marker of the truly invisible cases which are spreading in the community. The first step is to actually make sure that our community unlinked cases are less than 5. Second step is to make sure community unlinked cases are 0 consistently. Number 3, then the dormitory cases should be down to 0, if not less than 5 cases. After that, Singapore, we can set our sails fly, and then we can go full steam ahead again. Unfortunately, this will take several more weeks to come before that happens.
Well, we look forward to that, and thank you very much for speaking with us this evening, Dr. Leong. We were speaking with Dr. Leong Hoe Nam from the Rophi Clinic at Mount Elizabeth Novena Specialist Centre.